We have been making great momentum in our vaccination campaign right now in Rhode Island. As I've shared at past press conferences for us, Rhode Island has been a national leader in reducing cases and hospitalizations since we started our vaccination campaign. That was intentional, and we achieved what we had set out to do. We're seeing even more impressive results in our public health outcomes in terms of reducing hospitalizations in the groups where we focused our efforts early on with our vaccination response. As we shifted to phase 2, we are now in the top 10 nationally, 4% of our population vaccinated and 4 doses administered. We achieved what we needed and are making tremendous progress. This effort to get teachers, school staff, and child care workers vaccinated is keeping us moving in the right direction. One thing I want to emphasize is that we are remaining on schedule for the next groups in our vaccination timeline based on what we released several weeks ago. The next groups in our eligibility timeline are people 60 to 64 years of age and people 16 to 64 with specific underlying health conditions. We had set out a target to open eligibility for these Rhode Islanders in about mid-March, and we feel confident that we are going to meet that target. The reason why we're able to stay on schedule is because of the tremendous work that the team has done. We have been able to assess and address the fact that there were a lot of unadministered vaccine from the Federal Long-Term Care Facility Pharmacy Partnership, and have been able to bring that back into Rhode Island's general inventory to help us as we accelerate this forward. Given how vulnerable the people in nursing homes and assisted living facilities are nationally, when the federal government rolled out that long-term care facility pharmacy partnership, they over-allocated vaccines for that particular population to be conservative and to make sure that no facility would be short of vaccine. Because Rhode Island has a much larger population, that contributed to why so much vaccine was allocated to that group. The response rate in Rhode Island was good, but we had a lot of unadministered vaccine that we can now make directly available to teachers, school staff, and child care workers, which is great news. I want to make 2 last important points before passing things on to the Commissioner. There's been a lot of talk, appropriately so, about teachers, but we also want to make sure, as an important part of this, our child care workers are just as much of the priority. We're going to be working to ensure that child care workers are a focus for cities and towns over the next 2 months, particularly given the younger population that they serve and the close interaction that we have. So we appreciate our cities and towns really prioritizing and focusing on that as they roll this out quickly. The second point I want to make is that, as Tom said, teachers, school staff, and child care workers will be contacted to make appointments. Municipal EMA directors will reach out to school leaders and our DHS licensees for child care centers, and you do not need to call your city or town. Each community is taking a slightly different approach, but all communities will be reaching out to those who qualify in their areas among teachers, school staff, and child care workers. Lastly, I just want to acknowledge the teams at the Rhode Island Department of Health, the Rhode Island Department of Education, the Rhode Island National Guard, the Rhode Island Department of Human Services, and throughout all of state government. A tremendous effort went into working around the clock to get this plan into place quickly. We're excited about getting these and other critical populations vaccinated and keeping our momentum moving in the right direction.